Hi, my dear students. Today we will be discussing about the third part of antiarrhythmic drugs. In last class we dealt with the class 1 drug with their subtypes. Today we will be discussing about the class 3, class 4 and a short note and a short brief discussion on class 2 drugs. I hope you got some time in reading the first part, memorizing it, and to read the textbook about the class 1 drug. I hope at least some of you might have read it. Okay. Now coming to class 3, that is potassium channel blockers. Class 3 drugs, they include sotalol, amiodarone, ibutylide. Here amiodarone is a short note for you. In many ways it can be asked: 2 uses of amiodarone, 2 side effects of amiodarone, or amiodarone as the drug itself as a short note. Now let's see what is the common properties of class 3 drugs. Class 3 drugs, as I told you, inhibition of calcium channel blocker. So there is prolongation of the phase 3 repolarization without altering the phase 4 upstroke or the resting membrane potential. Now they will prolong the duration of action potential as well as ERP. Also they have a they also act as potassium channel blockers. They also have a function in blocking potassium channels also. In the ECG, that it will cause QT prolongation and PR prolongation. There is a QT and PR prolongation. So these are the peculiar features of class 3 drugs as in common. Coming to amiodarone, amiodarone is a short note for you. Plus, it is asked in many ways, either as 2 side effects or 2 uses of amiodarone. So this drug is a bit important for you, and please read it otherwise also apart from my slides. Okay. Now coming to amiodarone, if you look structurally, it is related to thyroid hormone. So it has an iodinated compound in its structure. Also it is effective when comparing to other antiarrhythmic drugs. This is one of the most effective antiarrhythmic drug, since and also it is used in arrhythmias where they are resistant to other drugs. Amiodarone, first we study, it is a potassium channel blocker. Apart from potassium channel blocking property, it can also block the sodium, calcium and alpha beta blockers. This will lead to the prolongation of the QT interval and QRS duration, which helps in the increasing the atrial, AV and ventricular refractory period. And also this drug, another peculiarity, it has a wider distribution, extensive distribution property. So they are taken up by tissues, especially the fatty tissues. The half-life is about 60 days, plus it is a potent P450 inhibitor. Amiodarone anti-arrhythmic effect is a bit complex if you look when comparing to the other classes, that is class 1, class 2 and class 4 drugs. The main clinical use of amiodarone. Now we say amiodarone is one of the drug among the antiarrhythmics which have a wide spectrum of antiarrhythmic properties. Patients with AF, atrial fibrillation, where there is a rapid rhythm control is needed, we can use amiodarone. A recurrent ventricular fibrillation and recurrent hemodynamically unstable tachycardia, all these can be treated or cured by using amiodarone. The dose includes IV 5 mg per kilogram over 20 to 120 minutes, then up to 15 mg per kilogram per 24 hours. Orally, initially we give 600 to 1.2 1200 mg per day, then it is reduced to 100 to 400 mg daily. It undergoes hepatic metabolization. It is liposoluble with extensive tissue distribution. As I told you, it is distributed distributed widely, especially the fatty tissues takes up amiodarone. Now, there are lots of side effects as a result of wide tissue distribution. Toxicity might lead to accumulation. If there is a larger plasma concentration of these drugs, it can lead to toxicity leading to accumulation. If you see the cardiac side effects, it includes heart block. I told you there is a QT prolongation as a result of prolongation of AP and ERP. It can lead to QT prolongation as well as heart block. Then bradycardia, in some cases bradycardia with cardiac failure and hypotension. In the liver, it can cause hepatic fibrosis, and in the lungs, it can cause pulmonary fibrosis. So amiodarone, since it has a wider distribution, it goes into all the organs and has accumulation leads to toxicity. In lungs, if you see fibrosis, pulmonary fibrosis, liver, hepatic fibrosis. As it has structure is similar to thyroid hormone, it can prevent or block the peripheral conversion of T4 to T3 that can cause hypo or hyperthyroidism. In the skin, it can cause bluish discoloration. Affecting the nails, it causes peripheral neuropathy. In the eyes, it gets deposited, causing corneal deposition. Finally, if you give digoxin along with amiodarone, digoxin level increases and it will lead to development of a new arrhythmia. So these are the side effects of amiodarone. So amiodarone as such function, mechanism of action is important, side effects are also important, unique when compared to the other, and also it is uses it can be used in any kind of arrhythmias. Coming to sotalol, I hope you might have heard about the name sotalol. It is nothing but a beta blocker. Now a racemate which has both the dextrorotatory as well as a levorotatory isomers. Both will exhibit anti-arrhythmic property. Now in addition, the L isomers, that is levoisomers, can also exhibit non-selective beta blocking properties. The uses includes to prevent recurrent atrial fibrillation and ventricular tachycardia, particularly after MI. Contraindication, since it can prolong QT, it contraindicated patients who has long QT syndrome, AV block, and severe asthma. Elimination, it is but you passed out through urine unchanged, and half-life is about 10 to 16 hours. The dose includes IV 10 to 20 milligram slowly and orally 40 to 160 milligram twice daily. This is about sotalol. Now coming to two newer drugs, that is dofetilide and ibutilide. These two are newer drugs not newer drugs, okay. In detail we won't study, but it should know the name dofetilide and ibutilide. These are calcium channel blockers, drugs that come under class 3. They have selective potassium channel blocking property with lesser side effects when compared to amiodarone. Can be used in atrial fibrillation to convert or maintain sinus rhythm, and it may also cause QT prolongation. No much detail, just know the names dofetilide and ibutilide. This is the newer class 3 drug when compared to amiodarone. Comparing with amiodarone, newer drug under class 3, dronidarone. Okay. Now this is an analog of amiodarone but not non-iodinated, which does not have a similar property or structure like the thyroid. Non-iodinated benzofuran derivative with the most significant molecular modification being removal of iodine and the addition of a methyl sulfonyl group. That is, in short, if you say, it is not similar to thyroid hormone. Now it is used to used for the prevention of recurrent atrial fibrillation and atrial flutter. Its efficacy in suppressing cardiac arrhythmias is inferior when compared to amiodarone. When you compare with amiodarone, only the structural property is not similar to thyroid, but when you compare the treating part, suppressing cardiac arrhythmia is just inferior to amiodarone. It is not associated with any side effects like thyroid, neurologic, ocular, or pulmonary toxicity. The most common side effects of dronidarone will be gastrointestinal, which includes nausea, vomiting, and diarrhea. Also, it can prolong the RR and QTC interval, which may mildly increase the QRS duration. Coming to class 2 antiarrhythmic drugs, I told you it is nothing but beta blockers or beta adrenergic drugs. Mechanism of action, I think you might be knowing about beta adrenergic drugs. Many times you have taught you that. It has a negative inotropic and chronotropic action, which may lead to the prolongation of AV conduction. This will diminish the phase 4 in the action potential and also suppressing the automaticity of ectopic focus. Okay. The indications of beta blockers includes treating increased sympathetic activity induced arrhythmias such as stress and exercise induced arrhythmias in atrial flutter and fibrillation, AV nodal tachycardia, and to reduce mortality in post myocardial infarction patients, and also protection against sudden cardiac death. Now coming to the class 4 drugs. Class 4 drugs are calcium channel blockers. Please make sure that in my previous slides somewhere I might have told class 3 are calcium channel blockers, but please once again, class 3 drugs are potassium channel blockers, and class 4 are calcium channel blockers. Okay, I'm correcting it in between. I have made a slip of tongue. I hope you people just realize that is a mistake. Okay, now coming to class 4 drugs, it is calcium channel blockers. Calcium channel blockers, it will decrease the inward calcium currents, resulting in a decrease of phase for spontaneous depolarization, that is especially in the SA node. Now this will cause a slow conduction in the calcium current dependent tissues like the AV node. Now two examples for drugs include verapamil and diltiazem. Now class 4 drugs will be dealt with in detail by Mirshad sir in his next class. Here just a few notes about calcium channel blockers. Okay, now because they act only on the heart and not on the blood vessels, it is useful in arrhythmias. Coming to verapamil, verapamil has a stronger action on heart than on smooth muscles, used in supraventricular tachycardias, 80 to 120 milligram thrice a day. Now adverse effect, if you ask me, it is the ankle edema and constipation, which are more common with the verapamil. Contraindicated patients with AV block, LVF, that is left ventricular failure, hypotension and WPW syndrome. Now diltiazem, it has a mixed action. The oral dose is about 30 to 90 degree 6 hourly. Coming to a drug that is naturally present in our body or naturally occurring nucleoside, adenosine. Adenosine, naturally occurring nucleoside. The receptors for these for adenosine is present in many locations, that includes the AV nodal tissues, the vascular smooth muscles. Now in the AV nodal tissues or cells, they will activate potassium channel and drive potassium out of the cell, thus hyperpolarizing the cell and making it longer to depolarize. So IV will suppress so as a result, if you give this drug IV, it will suppress the automaticity, AV conduction and dilates coronaries. It can be used. Where is it used? If you ask me, it is used in re-entry circuit. PSVT. PSVT is nothing but paroxysmal supraventricular tachycardias and supraventricular tachycardias. The only problem is it is very short acting, ultra short acting. T half is about only 10 to 20 seconds. And adverse effects, if you ask me, facial flushing, short breath, bronchospasm with metallic taste. Now rapid IV flush, that is about 6 milligram over 1 to 2 seconds, will be helpful in the above condition like PSVT and supraventricular tachycardia. When using IV line, flush with saline after each use. If no other effects after 1 to 2 minutes, give 12 milligram, repeat 12 milligram dose once. Depending upon no change in the tachycardia, you can give 12 milligram after 1 to 2 minutes, which repeating it again if there is no change. Okay, with here we finish out our class on antiarrhythmic drugs. I hope all of you go once again, read what is antiarrhythmic action potential, the different drugs used in the antiarrhythmic drugs, the 4 different classes with how they act. Okay, this chapter as such is important for you because the action potential can be asked as a question. Adenosine can be asked as a question. Calcium channel blockers can be asked as a question. Okay, and various subdivisions of class 1 is also usually asked as a question. Thank you.